चलो हाँ जी अनुज so good afternoon everyone. So I'll be presenting my case conference index. I'll be presenting the case of Mrs. Y. She's a 24 years old female housewife. She is a lab technician diploma holder, married 2 years back, mother to a 9-month-old baby boy, fourth in order of 4 siblings, belonging to a Hindu nuclear family of middle class socioeconomic status and resident of Dehradun, with identification marks of dorsum, central brownish birthmark present over dorsum of left hand. She was admitted from the OPD on 23rd of October this month. It was a voluntary admission under Section 86. The informants are the patient herself and her mother, Mrs. Rati Devi, who is a housewife and has been present with the patient during the initial part of the illness when the patient was not married, and is present with the patient since the past 3 days. And the third informant is the patient's husband, Mr. Bharat. He's a 34 years old male who has been present with the patient throughout the course of illness. The history provided is clear, it is consistent, it is provided in a continuous way. It is corroborative amongst the informants and provided in a chronological order. It is reliable, but it is inadequate in terms of the past treatment records are not available. She presented to us with chief complaints of low mood, loss of pleasure in previously pleasurable activities, crying spells, loss of appetite, disturbed sleep, bleak and pessimistic views of future, lack of concentration for the past 5 to 6 years, and episodes of abnormal body movements on and off for the past 2 years. Episodes of getting unconscious and having difficulty in walking, blurred vision for the past 15 to 20 days. Irritability and self-harm thoughts and excessive restlessness for the past 3 days. The history provided is the mode of onset of the history. It is insidious in onset and it is fluctuating in course with the waxing and waning with the course of treatment. History is precipitated by the desire to marry a boy against the consent of the family. The perpetuating factor is disturbed home atmosphere, lack of social support, and impaired occupational, socio-occupational functioning of the patient. Age at which the problem was recognized was at around 17 to 18 years of age. History of present illness. Patient was apparently well 5 to 6 years back in around 2016 or 2017, studying in class 9, performing academically well in school, cheerful, going out with her friends, having good interpersonal relationships with her siblings, her parents, when she was diagnosed with hydronephrosis of left kidney and underwent a surgery for the same in her hometown in Bareilly. While in the hospital, when she was admitted, she first met her now present husband, Mr. Bharat, who used to work there as a lab technician in the Department of Radio Diagnosis. She felt an instant attraction towards him, which led to an exchange of numbers. Thereafter, they would talk on call daily, day and night. During this time, he had shifted basically to Dehradun from Delhi for better opportunities. While she was still in Bareilly and she was going to school, they would meet less. They would meet less frequently, like 1 to 2 times a year, but they would talk continuously on call. They were connected on phone. Soon, she expressed to her family members her desire to marry him, which was refused, citing the difference in their caste, because the boy belonged to SC category and the girl to general category, and also the age difference between them, the boy being 10 years older to her. So the family members instantly refused to her desire. Also, she would doubt her then male friend of talking to other girls as well, as they were in a long distance relationship, and she would not be able to be with him be with physical touch and with him. So while he would refuse all of her acquisitions, she would put on him, but she would always keep on doubting him and would consistently be feeling of low mood and sadness. She would, due to these reasons, she would appear to be tensed and worried all day long, reporting of heaviness in her head, sad mood, difficulty in focusing in her studies, which even led to a fall in her school grades. And she was a very good student before. She unlike before, she did not like going out with her friends. Now and nothing made her happy anymore. She would be seen sitting alone most of the time, feeling helpless and hopeless regarding her future. Her appetite also significantly reduced during this period of time. When she still insisted to marry the same guy, family members thought of getting faith healing done. And the pandit, the priest who had come to their house to do the faith healing, said that iske upar to koi saya hai, and did some puja that day. Following which, there was an episode lasting for 2 to 3 days wherein she cried, then she laughed, then she would sit alone in a room. She did not sleep that night, and thereafter she was taken to a mental health facility where she was admitted for 1 day. No treatment records are available for the same, and there was total resolution of symptoms that did not occur ever again. Following this episode, the family members also started blaming her for everything bad happening in their family, because as the pandit said that ladki pe koi saya hai, so she would be blamed for everything. For example, when her father suffered from bony tuberculosis, she was blamed that everything is because of you, everything bad which is happening, which added to her sorrow. When she did not listen to her family members and continued talking to that guy, the family members cut all the ties with her, and that was in 2020, and she started living alone in a rented room in Noida, where she was supported financially by her male friend, her now husband, and the family members had no contact with her. She was living alone, and she was doing a diploma in lab technician course. At that time also, her sorrow increased more and more, because now her family was not there with her. Also, she was doubting the male friend, that he is talking to other girls as well. Now, while being alone, there was one incident wherein her male friend's phone wasn't waiting. He was on call for around 30 minutes. So she basically, what she did was she ate around 90 tablets. She was on OCPs for her treatment of PCOD, and she ate 90 tablets of all the 3 months course, 90 tablets of those OCPs, and expressed her feelings of expressed her death wishes and hopelessness and helplessness about the future. She was immediately taken to a by her younger brother who lived nearby. She was taken to a health facility, and she was perfectly fine. After that, after completing her diploma, she basically moved to Dehradun to live in with her now present husband. When in Dehradun, that was around January last year, in 2022, she saw text messages of some girls in his phone, which left her devastated, as now she had no support of her family as well, and she also found that he was also cheating on her. She would be seen sitting alone, crying most of the time, complaining of heaviness in her head, passive wishes, as she had ruined her life because she had no support now. After which, the now husband reports that she started having episodes of abnormal body movements characterized by twisting of hands and feet, uprolling of eyeballs, which would occur any time of the day, lasting for 10 seconds to 2 minutes, following which she would just get up all by her own and resume her day-to-day activities. She would remember these episodes partially, and these would also be accompanied by dizziness in head, heaviness, and blurring of vision, her incapability of seeing things around her. When the frequency of these abnormal body movements increased day by day, this was the first time when she was for these problems, she was taken to a mental health professional in Dehradun, wherein she was prescribed tablet Dothipin and tablet clonazepam, which led to excess sedation, and there was non-adherence to treatment. After which, they also consulted a neurologist for the same, because they thought that these are seizures. But they got a MRI done and EEG done, but no neurological cause was found for the same. So she consulted a psychiatrist from there on. After 2 months from that last year, after 2 months, in around March 2022, when the family members came to know about her condition, she was married, even when it was against their consent. And even during the marriage, similar episodes occurred when the family members taunted her regarding marriage against their consent. Even after getting married, the husband reports that she was sad most of the time, even after getting married to the boy of her choice, because she used to be sad thinking of her family members who had cut all the ties with her and would not talk to her now. She would eat very less. She spoke very less, would lie in her bed for hours thinking and crying, unable to sleep all night. She would lie in her bed, but it would take her hours to get to sleep. And then even at night, there was fragmentation of sleep. She would wake up again and again. During this time, she even got pregnant, and while during her pregnancy, she had repeated thoughts of aborting her child. She would sometimes sit with a knife in her hand that I want to tear up my abdomen and I do not want to give birth to this child because of a sad mood. She would not be able to do any household activities. And these episodes of similar abnormal body movement episodes would occur now and then, but the frequency was not that much as it used to be earlier. Then, after delivering a child in March this year, in 2023, her contact with her family members was re-established. Her mood also improved a bit when she was engaged with her baby boy. But as per her husband, even now, when her family members were talking to her, everything was going fine. She would still report of sad mood, and she would remain sad almost all the time, even when things were going well. She would not cook, not do a household work, she would not eat and sleep well. And he and her husband had, like, after coming back from work, had to feed the baby, change the diapers of the baby, wash the clothes, cook the food, and he was unable to find any reason for the same now. During this time, she was on medications, but no medical records are available, and there was improvement in her abnormal body movements, but sad mood always persisted. Around 20 days back, this month, husband reports of a quarrel with the neighbor over some trivial issue, following which she cried a lot. This was 20 days back. Also, there was a discord with her husband when he refused to take her shopping. After few days of these two episodes, there was one night, all of a sudden, while getting up from her bed, she suddenly fell on the ground, lied unconscious for few seconds, and after regaining consciousness, she reported that she was unable to stand back on her feet, that there is no power in her lower limbs and she cannot stand back. Reporting of numbness, loss of power in both her lower limbs, blurring of vision, and dizziness. And when this condition did not improve for around 2 to 3 days, she was brought to emergency in Indiresh Hospital on 15th of October this month. That was on Sunday. When she was brought to the emergency in the hospital, her eyes were closed. She was not verbally responsive, and she was maintaining postures of her like hands. So everyone thought that maybe she has gone into catatonia, and injection lorazepam was given. There was improvement in this. Now, course in hospital. When admitted in the hospital, she was started on injection lorazepam, 2 milligrams intermuscular thrice a day, and she was on this medication, but still she would take her husband's help when, like, going to the bathroom. She was still unable to stand on her feet, and she would complain of blurring of vision, after which she was started on tablet haloperidol 0.5 mg HS, and the husband was psychoeducated regarding her health condition and how not to like give so much of sympathy to her. After which there was improvement in symptoms and she was discharged on Friday, that is 20th of October. Soon after going back home, her mother had come. During this time, her mother had come back from Bareilly to Dehradun. Soon after going back home on 20th, she started complaining of heaviness in head, excessive irritability, crying and shouting spells, that shouting that I want to die, that I can never be cured. She called up all of her family members that please save me. I'll not be able to take this anymore. She even tried to, like, lock herself up inside a room, after which the husband removed all the locks from the doors of the house. And she was during this time, her persistent and pervasive mood was always sad and irritable at times. This illness had impacted her attitude, as in there was decreased social interaction with anyone. There was no pleasure in any, no matter what, in any festivals or any good accomplishments of her life. Even with her baby, she was not so happy now. Her biological functions during this time, her sleep was disturbed and her appetite was also reduced. Her bowel and bladder was normal and her libido was normal during this time. The negative history. Negative history. There is no history of any substance abuse, no history of any head trauma, no history of any Tonic, any clonic jerky bodily movements, any tongue bite, any urinary incontinence, a preictal aura or a postictal confusion. No history of any episodes of cheerfulness, over religiosity, over talkativeness, or increased activities. No history of any repetitive thoughts and actions. No history of any sudden onset palpitations or restlessness throughout the day. No history of self-muttering, self-finding, suspiciousness, thoughts being inserted into a mind against the will, or being taken away, or being known to others. Past history. She was living alone. Basically, she herself called her now husband that I've taken, like I've consumed all these 90 pills, and then he contacted her family members that please come and take care of her. Then she was taken to a health facility nearby, but fortunately, like there was nothing happened because of the OC pills. Told that she saw some messages. Then after seeing those messages and seeing that he was cheating on her, then also she got married to him only. Against the consent of the family members, because as per the patient, she then the husband present, he basically promised her that things like that will never be repeated in future, and they were not. So after marriage also, was she taking his phone? No, not now. She currently she is very much satisfied with her husband, and she trusts him a lot. She's very happy with him. According to her, her husband is like doing everything he can do for her, and has never cheated again. This is possible because even I asked the husband that because you were not present there, maybe she lied to you on call, but nobody knows now because the patient is accepting. She told me herself that she took those tablets, but we do not know how much is truth in that. Yes, ma'am. So was she trying to harm herself? She was, ma'am. Basically, she was just trying to run into the room. She barged into the room, trying to lock herself up. She was just trying, but at that moment, only the husband interrupted in between, and no, there was no fight. There was no argument. She just came back home and she was like, मेरे मूड स्विंग्स ठीक नहीं हो रहे, मैं कब ठीक होंगी, इससे अच्छा तो मैं मर जाऊं, मुझे ऐसा रहना ही नहीं है, मैं कभी ठीक नहीं हो पाऊंगी, फालतू में मुझ पे पैसा खर्च कर रहे हो, and all that. The husband was trying to calm her down, and her mother was also trying to calm her down, but no, ma'am, no child. As per the mother, everything started after the marriage. Yes, she, as per the husband, when like in between, when her mood was still better, she would do everything. She would take care of the baby, she would do the household work also. Like in the care of the baby, there was no negligence from her side, no matter how sad she was. At like that would occur some days of the month, and some days she would be fine. Sir, duration of the low mood is around 5 years. Sir, it is continuous. In between, there were few days when her mood was reactive, but a persistent low mood was also always present as per the patient, her mother, and her husband. There were days when she would feel better, sir, but almost continuous. So it was fluctuating in course. Oh, did you mention about the intent when she consumed those? Sir, yes, sir. Sir, her intent was to die because she had no family support and nothing left in her life. Mom, can we? So according to the patient, she wanted to die, but maybe it was she was trying to gain attention. But she took called exactly. She would not have called. Maybe it was trying to gain his attention. No, ma'am, no such. Basically, his phone was going on waiting since around half an hour. And she thought that maybe he's talking to someone else and she took those medications. Maybe it was, according to her, she wanted to die. She was having these thoughts from a long time because now she did not have her family support also, but she never acted upon them. But this time she acted upon them. Yes, ma'am. Then she called also him, he had done all this. Past history, there is a history of one suicidal attempt in 2020, and there is also history of typhoid. She was diagnosed with typhoid last month. Is in the present. Hanji ma'am, it's in this present episode. I just her typhoid. Treatment history. So the treatment history, no medical records are available for the same, but on the basis of recall, what I've been told is that there was one episode of faith healing in 2018. Then there was a consultation with a mental health specialist in Dehradun, wherein she was prescribed tablet Dothipin and tablet Clonazepam. And there was also a consultation with the neurologist, after which there was one consultation, after which she started consulting with Sanjeevani ma'am, and she's been continuous treatment from her since then. And she was on tablet escitalopram 10 mghs. And there was again a few episodes of faith healing done this year. And that is all. And because her treatment is going on, she's not breastfeeding her 9-month-old baby boy. He's on bottle. Family history. So family history. Family history. The patient is fourth in order of 4 siblings born out of a non-consanguineous marriage. There is history of chronic alcohol intake in father, history of bony tuberculosis and type 2 diabetes mellitus in father, history of pulmonary TB in younger brother. There is no history of any suicide, any low mood, any mood disorder in the family members. Patient's relationship with family members. Initially, there were discords between her family members and her, but currently the family empathizes with the patient and understands her illness, her need for treatment and need for follow-up. The patient is closest to her mother and her youngest brother. Birth history. It was a normal vaginal delivery at term. It was in hospital. There is no significant prenatal, antenatal, or neonatal history. Immunization was done as per the national immunization schedule. Developmental milestones were achieved as per age. Childhood history, there is no history of any hyperactivity, any attention deficits, any impulsivity, lying, stealing, eating difficulties, any sleep disorders, any attention-seeking behavior in childhood. Her relationship with peers was good. Home atmosphere in childhood, there is no history of any desertion by parents or a broken home or any step parent or any adopted sibling. There is history of interpersonal disputes between her parents, mother and father, and between her brothers. There is also intake of alcohol by her father, after which there would be a chaotic environment in her home, and there was a tensed environment. Also, they would pass comments on the patient and blame her for wrongs happening in the family. Scholastic history. The patients started school at around 6 years of age, and there was a good academic performance. There were no complaints from school. Occupational history, none. Menstrual history. Minark, she achieved Minark at 13 or 14 years of age. The duration of cycle being 7 days. Initially there was no history of dysmenorrhea or menorrhagia, but later on, after around 1 or 2 years of her achieving menarche, she was diagnosed with PCOD, and since then there are the cycles are abnormal, with only 1 day of bleeding, excessive dysmenorrhea. Her last menstrual period was 8th of October this month. Sexual history, there are good sexual relationships with husband, and the patient does not report of any use of any contraceptives. Marital history, the patient was married at 22 years of age, which was against the consent of her family members. Her relationship with her spouse are good, and they have good relations. They share the